Holy fire, holy water, holy money, only money, only money.
ATG and good evening once again. Dr. J here at Ask the Gynecologist, and tonight I'll be talking about fertility tests and how to do them properly. So if you're free, once again, as always before, join me tonight and let's have a close discussion about this. I'm here live on Instagram, and we're also live on YouTube recording, which will be posted soon. And we're also live here on Facebook at Ask the Gynecologist. I'm sure I need to introduce myself once again tonight for our host and for our members that are just joining. So once again, people want to say, what is this Ask the Gynecologist? And I'm sure most of you watching me tonight have invited your friends to Ask the Gynecologist. Probably you were even invited to join our group by your friend somehow. This group, which you are and which I am on now talking, is Ask the Gynecologist, and it's called that for a specific reason. The reason why we call it that name, and why we've chosen that specific name, is because it's about you, about the woman gender, about how to improve the lives of our women and how to ensure that people know what to do. You see, this day and age, information will differentiate you from who you are and who you're supposed to be. So by coming here, listening to things we say, you're probably going to get one or two things. And by attending this our church program, I'll say in quotes, ATG is like a church, like a tribe. By attending this program all the time, at some point, you pick up one or two things that will change your life, and most importantly, change the lives of people around you. So every day you come here, every day you read our posts, you watch your videos, you watch my video, Dr. Esther's video on Ask the Gynecologist. At some point, you pick up something new and genuine that will transform your life. So if you're watching me, I can see Temitope Mary Adegungunyemi Kudi Dowu. I can see Mary Shiny, wonderful lady, and Temi Posh Emewe and Kelechi Uchebu on Facebook here. They are live and they are watching and they are listening. And on Instagram here, I can see Lily Mama, one of our moderators, and Sukre Eve, Baby Manex, Jesu Sheung, Chidi Ebere, Hair Glimery, and Yetunde 8080. God bless you all. And Christina Oladumoye Idowu and Emmy Ikatua. Thank you, Emmy, for being here. And Fidelis Christina. Emmy all the way from Delta region in Nigeria. And Christina all the way from Lagos and Nigerian Southwest. And Chinyere Eze. Chinyere Natasha. And Amara Juliet. Once again, I'm happy to be here. Stella Kayit, thank you so much. And BJ Pumping. Peculiar Baby, wonderful, from Instagram here. I'm happy to be alive, and I'm sure you are. The thing is that every day we spend here on this live consuming the resources God has put here on this earth is for a purpose, and that purpose must always be fulfilled. Our purpose here is to ensure that we put smile on another person's face. Our purpose here is to add value to our friends around us, to add value to the world, to the creation. And thank you guys for the purpose we have on ATG here is to make your lives positively better and to change your situation consistently. Whatever you find, whatever you're looking for, whatever you found in ATG, always share with somebody else. By sharing what you have, it will come back to you in multiples. So I can say with all faith, with all assurance, that as far as you are here and you come here with an open mind, with no negativity, definitely God is here and God is going to bless you. And I have no doubt about that. I say it again, I have no doubt about that. Thank you, Duru Kingsley, Chizoba, Juliet, Michelle, Michael, Kate, Anara Abo, Amolara, okay, Lilian Ochieku Chika, and Christabel Udochukwu Nadi, Chinwa, Loreto Odawalu, Judith Mary Chimeze, Unwobodo Uchenna Betty, Babalola, Abiola, Abiodun Ajibade Bidex, Emmy Ikatua, a wonderful lady, and Jane Onyechi Nwabeke Onyasi, Linda Missan Alabi, Onyechi Ada Ikechiku, Mustafa Basakat Balanle, Rati Morupisi, sorry, Amaka Modozie, Jane Ojelomo, Grace Obidi, Jane Onyechi Mwabeke, Green Bopsy. So it's green. You're saying my lips is very pink. That's how God gave me. I think I inherited it from my mom. Nena Azubuike, Elizabeth Okai Igalo, Obi Tricia, Vivian Indiribe. Thank you so much, my wonderful lady sister. And my wonderful, beautiful sister, Taye Owolabi. Thank you so much for being here, Stella Kayet. And on Instagram here, we have official Nika, Ozi Fashion Hub, Olatubosun Moyeni, Oluwa Jomiloju, 123, and we have BJ Pumping. And let us go to the meat of this discussion tonight, because people are getting sleepy, people might have questions to ask, and we want to get it done. This month of April is a very short month, okay? I know that for sure. April is 30 days, and the Easter break has taken almost a week chunk out of the April already. This month, you're well aware, the ATG Foundation, ATG Women's Health Foundation, is launching the IVF Center at AsktheGynaecologist, and it will be opened June, July this year. Already, my secretary, Nike, she's already taken bookings already of people that are waiting in line to do the IVF procedure. Now, you see, because of COVID restrictions, we have to get these things done as soon as possible, and we need to get these things done by getting people booked in quickly so that we have to avoid the rush. If you need IVF, if you've been told you need IVF by me or by your doctor, please get booked in. And if you're traveling from America, from London, from UK, from Germany, from Canada to Nigeria to get your IVF done at the ATG Center, get booked in now, okay? And also, Nika will tell you the cost and the details, and also you can even do your payment plan and save with your own account, or even save with ATG, and we can keep your money, and whenever you want to get it done, you balance and get your IVF done on time without delay. There are many facilities available, including egg donor, surrogacy, IEC. We can freeze your embryo and use it at some point again, and the cost is minimally very, very reduced to ensure that it's affordable to people, for people in Nigeria, in Lagos, in Southwest. See, some people say, oh, I'm in Abuja, Lagos, something. My sister, somebody is traveling in from Canada. Somebody's already preparing to travel in from London with her husband. Somebody's traveling from America as well. So don't say because I'm in Port Harcourt, Kaduna, Lagos, somewhere, it's far away, I'm on the island. Look, whatever you're looking for, find a way to get it, okay? It's in Lagos. It's on Lagos mainland, close to Agege airport. You can get there easily from any angle, okay? Make up your mind. You want to get this IVF done, and don't delay. Whether you're in Abuja, you can fly down. Somebody's traveling from Lagos. I know it's expensive, but somebody's traveling in from London. I know the person with her husband. They are coming in to get the IVF done in Lagos at ATG Center. There's a reason for doing that. Don't be delayed. Let your joy be full. And you are going to be guaranteed success by the grace of God. So you have no reason not to get booked in. ATG has come a long way. We've done things to ensure that people feel so much part of the program. We've realized that 80% of people in the ATG, the problem is infertility. Therefore, we've moved steps consistently to produce a laboratory that can cater for infertility investigations. And now we have an IVF center, and we are not going to stop there. We are going farther than that. We're going to ensure that IVF is accessible to people even on the island, even in Abuja, Port Harcourt. We are coming there without delay. And that's our purpose. That's our plan. That's our aim. We're not going to relent, because we want you to change, and we want to bring joy and kids to your family. That's the purpose. This month, the purpose of this month's seminar is the ATG IVF Super Class Summit. And that class is important for you, because I'll be discussing on the reasons why IVF fails, and how you can reduce failure in your IVF program, and how you can get guaranteed success by the grace of God in your IVF program if you're going for that. During the IVF seminar in April, okay, which I don't want you to miss, you will get preferential treatment, and if possible, discounts, which I'm getting arranged with my embryologist, discounts to ensure that you get your IVF even much cheaper. So if you attend the program, the seminar this month, which is only 2,000 naira, you're going to get much discount to ensure your IVF is a success. Now, before we waste time, before we go too far, the talk tonight is to discuss about the purpose, and the reasons why we do investigations for your IVF. Now, if you're not yet following us on our social media, on YouTube channel, you should subscribe now. The link for the YouTube channel is going to be posted now by our team members, our moderators online. you need to subscribe to the YouTube channel. And the purpose of being on the YouTube is that our videos will be arranged on YouTube chronologically, so you don't miss them. Sometimes you come on Facebook, the videos are totally in chaos, disarranged, put up and down. What I'm seeing on Facebook is not what you're seeing on Facebook. But on our YouTube channel, our videos like this one will be recorded, we post and posted there, and they are therefore arranged in chronological order. People are already subscribing to the YouTube channel of ATG, and they're not missing any of our videos. Okay, if you're planning to get married, you should go and watch a particular video on our channel on YouTube. In that video, okay, I explain the things you should get done so that you don't get sucked into the black market of infertility. So go and watch that video on YouTube now. If you're not yet there, go and watch it and subscribe there and watch the video over and over and over and over again. Once again, tonight, I'm Dr. Alalade, one of your admins at AsktheGynaecologist, and I'm talking about special investigations which must be done to know and to break down infertility. I already told everybody here all the time that infertility is basically three main problems. And I said all the time that infertility can affect the man, can affect the woman, or can affect both of them. And how do we investigate when man or the woman has the problem? Remember, I said repeatedly that infertility, okay, is 40% the man's problem. Infertility is 50% the woman's problem, and 10% of infertility problems is both gender. So if you see 100 people come to the doctor, to the infertility clinic, 50 times out of that 100, it's going to be woman issue. 40 times out of that 100 is going to be man issue. And the remaining 10%, 10 cases will be mainly both of them. Infertility can affect the man, can affect the woman. And the three things that can cause infertility are these: problems with ovulation. The egg is not releasing egg, and the egg is not releasing eggs. The ovary is not releasing egg. That's number one cause of infertility. Number two cause of infertility is blockage in the tube. There's a blockage in the tube. So eggs released from this ovary cannot move into the tube and move along the tube to get into the womb cavity. Number two. Number three is problems with the man. Failure of sperm production, of sperm transport. So sperm can be produced or not produced. Sperm can be produced and they can't find their way out when the man releases. Okay? So these are the main causes of infertility. Remember, I've mentioned these three things. Have I said anything about sperm flowing back? Some people think that if they get up from the bed after their husband is on top of them, or they're on top of the husband, the sperm will pour out. That means they can't get pregnant. Some people, they are afraid to even be on top. See, there's nothing wrong in you as a woman being on top. It doesn't cause infertility. And there's nothing wrong in you doing doggy. It doesn't cause infertility. Some people think there's a particular position during sex that will make them get pregnant. Whether you want to do doggy, whether you are being on top as a woman, or whether the man is on top of you as a missionary, or you do reverse missionary. Nothing, no sex position will cause you not to get pregnant. Any sex position will get you pregnant. Okay? Whatever suits you, do. And remember, I've said these three things. Did I mention any of them that you have to put your legs up or hang your legs up into the sky? No. Sitting down in bed after sex does not guarantee you pregnancy or not. If the sperm is bad, you're not going to get pregnant. If the sperm is good and there's no ovulation, you're not going to get pregnant. If there's ovulation and there's blockage in the tubes, you can't get there, you can't get pregnant. Now, remember, I said again, three things causing fertility. Number one, blockage in the tubes. Number two, not ovulating. Number three, sperm problems. Now, let us take them down one by one, and I'll go into details and questions what infertility is and how you can prevent them. So please listen and reggae. Let us move. Now, infertility, remember I said number one cause is ovulation problem. How do you know if you're ovulating or not? I said all the time, you don't have to see egg white to know you're ovulating. Whoever told you that is joking. Okay? Yes, if you see egg white, the chances of you ovulating is higher. Yeah, but you don't have to see egg white to guarantee the fact that you're ovulating or not. Egg white is not a guarantee system or a guarantee proven sign to say you're ovulating or not. Let me tell you something. If you're having regular period, your periods are bang on schedule, you can time your period with your phone app, and your period is regular, the chances of you ovulating is almost 80% to 90%. If your periods are regular, the chances of you ovulating is almost 80 to 90%. So that's the first thing I ask a woman if they come to me and ask me and say they can't get pregnant. I say, are your periods regular? So once we've done that, okay, how do I do tests to know if that woman is ovulating? Remember, I said again, seeing egg whites does not guarantee that you're ovulating. Even if you don't see egg white, doesn't mean you're not ovulating. Some people say, doctor, before, whenever my husband touch me, I'm already wet. Now he's touching me, I'm not even wet after 10 seconds of foreplay. It does not matter. Foreplay does not guarantee you pregnancy. Foreplay does not make you wet alone. Foreplay can make you wet, it might not even make you wet. Sometimes if your mind is not in the bedroom, you're thinking of your business or your delivery, or somebody that has taken money and is not giving you delivery, you might not even get wet in the bedroom. It can happen. And there are ways to deal with that. If you're not wet in bed, you can use lubricants with pre-seed. Pre-seed lubricants is even very, very good. It makes the vaginal environment very, very conducive for sperm to live, to delicately travel, jollificate travel, and swim into your womb cavity to go and knock the egg and get the egg pregnant. So use pre-seed. If you're going to have sex regularly, consistently, like I said, 2 to 3 times a week, use pre-seed lubricant. It makes the sperm and the vaginal environment comfortable, conducive for sperm to travel, swim faster, and make them cushioned and wait, ready to target and to go and get that egg, bam, and knock it and get pregnant. So if you're having a regular period, you're likely to be ovulating. Now, I will need to do some tests anyway to know if you're ovulating or not. What test will I do? I do your follicular stimulating hormone, your FSH hormone test. Follicular stimulating hormone test is your FSH hormone. What is the purpose? That hormone, FSH, comes from your brain. It goes into your bloodstream and gets to your ovaries and tells your ovaries to release egg. To what? To release egg. That is your FSH hormone. The same thing to another hormone that is the brother and cousin of FSH is LH, luteinizing hormone. It comes again from the brain, from the part of the brain called the anterior pituitary gland. Lubricant Ujunwa is pre-seed, P-R-E-S-E-E-D, P-R-E-S-E-E-D. Please, my dear sister Odumoye, Oladumoye, help me put the text of the name of the medication. Thank you, Vivian Dico Briggs. I can see you, my wonderful friend. Our sisters and all our cousins, they're all my friends on Facebook. Thank you, Vivian Dico Briggs, wonderful lady. And greetings to my professor. You know who I mean. Anyway, now let's continue. So, you do your FSH hormone, your LH hormone. These are hormones from the brain that tell the ovaries to release egg to what? Ovulate. If I want to know if your body is producing FSH appropriately, I do your FSH hormone. And there are specific times during your period, during your cycle, which we do that. Remember, you're supposed to know what your menstrual cycle is. You're supposed to know what your ovulation is, what fertile window is, what your menstrual length is. They're all different, but they're all together. So your menstrual cycle length is the amount of days between the first day you see bleeding for this period and the next period you see the first bleeding again. So you see your bleeding, first day bleeding this period, the next period again, first day bleeding. Okay, how many days in between? That is your menstrual length, menstrual cycle length. So whenever it's your day 2 to 3, as soon as you see your period, day 1, you go to day 2. Day 2 of your bleeding is day 2. Between day 2 to 5, you go and do your FSH and LH hormone. It's important. If it falls on a weekend, talk to your lab. Let them know in advance so that you can get it done and not miss between your day 2 to 5 to get appropriate result, appropriate reliable number. That is number 1 test you do to know whether you're ovulating. Another test you do if you know whether you're ovulating is your day 21 progesterone. You count 21 days, and day 1 being the first day you see bleeding. Count 21 days from that. You get to day 21 progesterone. You do your blood test for progesterone. If it falls on a weekend, arrange with your lab. They can get someone to come into the lab, take your blood results, and put it in the fridge until the day they run the test. It's important you do it on day 21. If you have irregular cycle, okay, if you're not bleeding at all, okay, if you're not bleeding at all, we can give you some specific medication to make your period happen, and then we count 21 days from there. If you're not having regular period at all, and you don't know where your period comes in, once you see your bleeding, your first day of bleeding, go and do the test on the 21 after counting 21 days. If you have no period at all, no bleeding at all, everything is stopped, everything is 2-second burst, we give medication to make and to induce your bleeding, and we count that 21 days. So that's number 1, FSH, LH, day 21 progesterone. Then we now move to another test called prolactin. Prolactin is an hormone also produced in the brain that tells the body produce breast milk. Okay, if you have high prolactin in your blood, what the body is going to say is that don't produce breast milk, don't ovulate, because the body is not yet ready to get pregnant. So if you have high level of prolactin, more than 25 on most occasions, okay, what he's saying is that I'm not ready to get pregnant, I'm not ready to ovulate, and your body will not ovulate. So we need to check your prolactin level. Again, LH, FSH, day 21 progesterone, prolactin. We also need to check your thyroid hormone. Thyroid hormone T3, T4, TSH. T3, T4, TSH. TSH is thyroid stimulating hormone. T3 is triiodothyroxine hormone and tetraiodothyroxine hormone, T4. Basically, they are all basically thyroid hormones, and your T4, thyroid stimulating hormones. We do all these tests to know if you are ovulating or not. Okay, definitely to do your testosterone, and also we do your rubella. Rubella is a virus which if you catch in early pregnancy can cause miscarriage. So we want to know before you get pregnant whether you are rubella immune. We don't want to get you pregnant, then now you not contact rubella because you're not immune, and it now damages the baby and causes miscarriage. That's why it's important while you are doing your fertility test, you do your rubella tests as well to know whether you're rubella immune. And if you're not rubella immune, we give you the vaccination before you get pregnant. Okay, it's important. Some people, they've had the rubella vaccination before when they were young, but sometimes they lose immunity. So we need to check you whether you are rubella immune before you get pregnant or while you're on a fertility journey. It's important. We also need to do, so that is about ovulation. It's also important. Genevieve Oroluchi, welcome. Sylvia Ofyong, Loveline, Uzwa, Amadi Ijoma, Pretty Naz, and Christina Alalade, a wonderful lady, she's here moderating for us. Striving Muslima, Zauja, Sophia, and Noria Juliet, Amara Juliet, Princess Adewumi, Ajikobi, Ajiri, Blessing, Elo Nuafe, Soli Mariam Saliwa, Raf, Pretty Faith, Catherine Ogada Osai, Ebonluwa Janet, Onoja Agnes Asuko, Iena Shaw Vivian, Sylvia Ofyong, Blessing Prospect, Dab, Mercy, Emmanuel Oti, Joy Eze, Obodu Osarumwen, Choice, Ansai Oge Chifianyo, Ifi Obieke Ejogu, Chidima Joy, Bumi Falano, wonderful lady, thank you, my sister. Mimi Masok, Oladipupo, Rukayat Olaurumi, Ogunleye, Fatima Adejoke, Jane Maduka, Agu. Thank you guys for being here on Facebook. If I've missed your name or if I've mispronounced your name, sorry. Okay. For those on Instagram, your names are like nicknames. I can't really cut them from here, but welcome once again on Instagram. Thank you for being here, guys. Now let's continue. So that's a test for ovulation. If you've missed this video, watch it over again from beginning, okay? Now, to know, so that's number one, to know whether you're ovulating. Number two, to know whether your tubes are blocked or not. Two tests we can do to know whether your tubes are blocked is HSG. I know people will say HSG is uncomfortable, but sometimes we have to do it. We need to do the HSG. HSG is hysterosalpingogram. It's an X-ray test. We're pushing a dye, a contrast dye, through your vagina into your womb cavity, and it goes in there and flows into your tubes on either side. If your tubes are patent, patent means they are not blocked. If your tubes are not blocked, the dye will flow into your tubes on both parts, on both sides, left and right, and it will pour out. That means that the tubes are not blocked. If HSG is not tolerable, you're in pain, or we can't do the procedure for some reason, we can even do what we call laparoscopy and dye test. Laparoscopy and dye test is also a test to know whether your tubes are blocked or not. We put it to sleep, okay? We put a camera through your belly button, and we look into your tummy. We push in a blue dye from vagina. You'll be asleep though. We push in a blue dye from vagina, it goes into the womb cavity, and if the tubes are not blocked, while we put in the camera through your belly button to look into your tummy, and we will now see if the blue dye goes into your tubes and pours out on either side in your tummy. Don't worry, your body will reabsorb the blue dye and it does no harm to you. It's methylene blue, it does no harm to your system. So the body has a way of absorbing the dye. So we do laparoscopy and dye test only if we can't do HSG, or if at that point of doing your infertility test, you also have endometriosis or you have ovarian cyst, and we're going to open you up anyway or do a keyhole surgery anyway, we do laparoscopy. Laparoscopy is a keyhole surgery. We don't open you like a big cut. We put a camera through your belly button. We call it keyhole surgery. So we put in that camera and then we look at it as the dye goes through and pours into your tummy. We can do those two tests. HSG is much cheaper, slightly uncomfortable. That is why if you're going for HSG, I always tell people to do two things for me. Take painkillers like ibuprofen, diclofenac, or paracetamol an hour or two before going for the HSG. You can also have Buscopan. Another thing you can also do is that before you go for HSG, a week or two before going for HSG, do your eye vaginal swab test and endocervical swab to check for chlamydia and gonorrhea. You don't want to push infection either in your vagina into your womb and cause PID that will now go and damage the tubes because you didn't do this test. Before you go for HSG, a week or two before going for the test, HSG test, go and do your vaginal swab test to check for infection like chlamydia, gonorrhea, or anything in the vagina, so that you don't push infection in your vagina into your womb that can cause more wahala. So it's important. If you're not sure, or if the tests are not giving you a conclusion, or if you can't do the test, then there's a special antibiotic we give you, which you take on the day of HSG called azithromycin, 1 gram, swallow pam. So that's HSG. That test will check if your tubes are blocked. If we can't do HSG, or if you want to do other operation at the same time too, we can do laparoscopy and dye test. But that must be done under anesthesia. That is the second one, laparoscopy and dye test. Now, the last test which we must do is also, sorry, the other test we must do is also ultrasound scan. We don't want to waste time if we don't know whether you have ovaries or not. Some people, they don't have ovary. It's a congenital problem for some people. We want to know before we start the journey, does this lady have ovaries and womb? We do ultrasound scan. We check the ovaries. Does the ovaries look normal? Does it look different? Does it look shrunken? Is the womb okay? Is the womb defective? Has it got a normal womb cavity, one cavity, or separate womb cavity? All these tests must be done, ultrasound scan, before we start or we embark on a journey of infertility. Now, the last thing is the men. The men must support their wife when they are going through infertility journey. I've seen the journey of infertility started already, and I realize that the man is the problem. That's the challenge. It's not even the woman, but the woman started the journey. Men and women support each other doing infertility journey. Men support your wives, women support your husband. It's two. It takes two to tango. Don't say it's your problem. You're not giving me a child. No, it can be anybody's problem at any point in time. It might be okay for you today. It might not be okay for you tomorrow. And it can happen to anyone. God forbid it don't happen to us. But if it happens to you, to your family, support your husband, support your wife. Work together. If the finances is not working at that point in time, you can slow things down. There are options. You can work towards things. Time may heal situation, but work together with each other. Men, there's only one test you should do at the beginning of infertility. A woman does barrage of tests, injection, HSG, ultrasound scan, the scanning the vagina, scanning all this, but only one test men should do. And men should support their wife and not find it difficult to do this thing. Is semen analysis. And while you're producing the semen, usually through masturbation, it's not even painful. So I always wonder why men don't want to do this semen analysis. The test is not to demean you as a man. It's not to reduce your effectiveness as a man in your home. It's to know if there's a problem and how the problem can be addressed. So support these things. Do these things at the right time so we can know. And if you have the problem, as a man, there are things we can do. If we realize that, okay, yes, because you're not producing enough sperm, we can even go and find out and do some hormone profile for the man to see if he's producing hormone and if he's able to produce some sperm. And we can go and aspirate the sperm from the testicles. Procedures we call PESA or TESA. We can aspirate the sperm, good sperm, and get it to fertilize the woman. So these are the things we should do for the men. Okay? And during this journey, the most important thing is support each other psychologically and physically. Don't just support each other in words. Let it be in rhetoric and action. Action. Love is always shown with action. Love is an active verb. Love is activity. Love must be done. If you're going through this fertility journey and you want to start it, take that step today. There's no beauty you come to listen to me on Facebook, on YouTube, on Instagram, and you're not taking consistent steps towards your dream. I'll start taking questions now, so chill. Tomorrow morning, take your phone and call the laboratory, my lab manager, my secretary, Nike, and she'll tell you the test you're supposed to do. She'll go through the list with you. She'll tell you how to get to the laboratory, and then you can start your journey to fertility. Call Nike tomorrow morning. And also, while you are there, if you know that you're already needing IVF too, you can put your name down, and she'll tell you the costs as well for the IVF sessions, so that you can know the cost and you can get started on that your journey to bring that baby into your home. Every journey starts with a step. Tomorrow morning, take your phone and call. The numbers of the laboratory is on the screen. So thank you, my sister from Kenya, Karanja, Ezora Chinaza, Alishola Adekombi, Chinenye Ibe, Chinazo Rita Ungu, Rose Victor Thompson, Oluwashim Ojo Ojugo, Immaculate Oluigbo, Edenike Adebayo, Alagochia de Favor, Clarissa Tabiti, Ella or Steve Omono Garan, Smart Phil, Afiniki Wilson or Umo, Faith Pretty, wonderful, Ngozi Steven, Chinyere Vivian, Abimbola Alabi, Onyechi Ugo, one of our moderators, Maria Stella Ujo Ogidi, Ansa Ogechi Fiani, Bibi James, Kennedy Olayemi, Patty Stevens Harkams, Oboju Choice, Olatunde, Thiwo, Lillian, Chinazo. There's so many names. I can't capture all. So let's start taking questions now, because we need to start taking questions, because it's already to 10 o'clock and people are feeling sleepy. Me, say, I'm even hungry. I need to eat. I need to refuel. So let's start taking questions now, okay? God bless you all. Now, because I've missed some questions above, because I've been talking, I'll start taking questions now. I'm in at Owolabi. I don't check my messenger anymore. When I open my messenger, I see over 10,000 messages. My sister, if I employ somebody to even do it for me, that person will work the whole year. So I don't even check the messenger anymore, because it's not shakarao. It's because I have to work in the day. As a doctor, I go to work, hospital. And when I get home at night, I use the time here to spend with you. So I can't check all messages on messenger. Even the one I have on that thing, WhatsApp, is so much. So it's just because of time. I can't. So therefore, we've opened an ATG email, and we've employed people that can answer the messages for me and answer simple things. And the subscription ones, I answer them, so I can take their question one-on-one. So if you want to talk to me, just go through the subscription links. Premium services. We have the weekly, we have the consult, which is the 1 month, we have the gold 1 year, the diamond 1 year, and the premium services for the video consult, platinum. And you can contact me, and I'll be answering you and discussing with you on the WhatsApp number. This phone here for this Instagram post is one I use for my WhatsApp number, and I answer the questions patient and get their problem resolved. Now, somebody is saying, how can I get your mobile number from Abakaliki? Chuku Ejiro. Just go to the email atgservices2018@gmail.com, or follow the information here by Winyechi and my Christina sister. They'll put up the links for the ATG services. Join the premium services, and then we'll chat one-on-one from on WhatsApp. Can pregnancy be achieved with one tube? Yes, pregnancy can be achieved with one tube, definitely. I've seen so many women here in Nigeria, they've achieved pregnancy with one tube. Even if you've removed one tube before and you got ovaries, whichever ovary releases the egg, the remaining tube that is there, that is okay, can pick up the egg from either side. So if you ovulate from left or right, that good tube that is okay, that is there, can pick up the egg from anywhere. Thank you. Someone is asking a question about Asherman syndrome. Can someone with Asherman syndrome still get pregnant by herself? If you have Asherman syndrome, that may affect you from getting pregnant too. But I've seen people with Asherman syndrome, they got pregnant on their own. Yes, naturally. But if you have Asherman syndrome and it's so bad, and you've been told that, then we have to go through a camera, a stereoscopy, to look into your womb cavity to remove any scar tissue in your womb, okay? After sex, sperm comes out. Duru Kingsley, I've already answered that question already at the beginning of this post. People talking about sperm coming down after sex, I've already answered that question. As far as the sperm is good, sperm will always pour out from sex. If I have sex with my wife, sperm will pour out. It's the law of God, the law of gravity. But as far as the sperm is good, okay, that sperm that is good will always find its way into the womb. Okay, it's natural. Sperm will always pour out, no matter who you are. Whether you are prince or princess or queen, okay, if you have sex, sperm will pour out. But as far as the sperm is good, it will find its way into the womb and get you pregnant, okay? So I've already answered that question at the beginning of this post, so watch that and listen at the beginning. Probably you came very late, my sister. Can someone save their egg? Yes, you can freeze your egg at our ATG center. Yes, Children, but it comes at a cost, because we have to use liquid nitrogen to vitrify and save the eggs and the sperm, but it comes at a cost. The cost is charged every 3 months, okay? Once you're booked in for the IVF, we'll go through all that with you before you start the procedure, so don't worry about that. We'll go through the cost with you, and then you decide whether you want to go for that or not. But let me tell you something. It's much better to achieve success in IVF if we use fresh embryo. It's much better to achieve IVF success if you use fresh embryo. For some reasons, we have to do storage. We have to store the eggs, store the sperm, or what have you. But it's much better to get success if we use fresh embryo. Someone is asking a question: is there any drug to use for uterine addition instead of adulteration? No. Uterine addition is different from block tubes or chinaza. Uterine addition is scar tissue in the womb. That's different. That is scar tissue in the womb. We take that out by hysteroscopy, okay? Now, adulteration is done if there's blockage in the tubes, okay? If there's blockage in the tubes, we do adulteration for that. Adulteration success rate is 25%, 1 out of every 4. So it's not always very good. But uterine addition is different. Adulteration is different. If you're asking for any medication to unblock tubes, if tubes are blocked, we have to unblock it through adulteration or consider IVF. If you have scar tissue in your womb, we take it out through hysteroscopy. HSG is uncomfortable for some people. So to prevent HSG pain or discomfort, you take some analgesia before go for HSG. Paracetamol, ibuprofen, Buscopan is very good to take before going for HSG. I've seen people who do HSG. I did HSG for 3 people 2 weeks ago, 2 weeks ago, and they were in no pain. I've done HSG for somebody before too last week, and she was in pain. So it all depends on perception, understanding of what is going on, and people's different pain tolerance. Okay? Well done. Thank you so much, Sister Alimosho. Alimosho is saying, is there any drug to improve fertility? Now, if I want to give you a drug to improve fertility, the first thing is that most people don't have infertility problems. Once you are born as a human being, you don't usually have infertility problems. But if along the line you have infertility problems, I need to know which infertility problem you have. Remember at the beginning of this video, I mentioned so many different types and different causes of infertility. So for me to give any drug, I need to know what is the cause of infertility in you or your husband. Then I'll be able to give a particular drug or advice for any particular treatment to reduce or to treat the infertility. But I cannot give a blank check. Go and take this and this and this and this. I'm not a babalawo. I'm not an herbalist. I'm a doctor. I go through tests and I provide the best solution to achieve success. So there's no one drug for everybody. You have to know what is causing fertility in your situation, and then we address it as it is, case by case basis. How do you get twins? If you want to get twins with all guarantee, you have to go by IVF. Okay, that is the honest truth. If you want to, for me to consult with you one-on-one, go through our premium services. We have weekly consult, we have the monthly consult, we have the gold package, the diamond package, and the platinum video consult, where I talk to you live, video to video, on Zoom or on WhatsApp, and you can see me talk to you. I go to your stuff. I've seen so many people go through that new service now, and they've been reassured and they're comfortable using that service. There's a question here on Instagram. Can somebody get pregnant with a 4x8, 4x9, 5x4 fibroid? Yes, it's possible. You can. But if you have such fibroids, they're so big, to be honest with you. If you put all those fibroids together, they're as big as this. So if you have such fibroid in your womb, and your womb is only like this, and you have a big fibroid like this already attached to your womb, I suggest you take it out. You take it out before you start planning for pregnancy. Just take it out, please. And if you don't know where to go, you want someone to get you a doctor that is assured and a good doctor that can take out fibroid. I have a friend of mine here, Dr. Benjamin. He's a good surgeon, and he does what all the time, almost every day. He takes out fibroid. That is his bread and butter. So if I refer anybody for fibroid surgery removal, I have a lady here watching me now. I referred to him about 6 months ago. She had a fibroid removal. She was so scared and so apprehensive about the surgery. I told her to go to Dr. Benjamin, and it was removed, and she's happy, and she's better now, and she's already on the way to get pregnant as I'm talking to you. So if you want to remove your fibroid, that's for Luxury Lash by Rookie. Get in touch with me, and I'll refer you to Benjamin. Benjamin is in Lagos, is in Ikeja, Lagos area. Thank you. For the upcoming seminar, it's on IVF fertility, and there'll be discounts available for people that want to do the IVF at the ATG Center, which is going to open in June, July. If you want to be on the first list to get your IVF done at the ATG Center, call the lab tomorrow morning and talk to Nike, my secretary, the lab manager, and she'll get you booked in for the IVF session as soon as possible, so that you don't get pushed to the back of the queue. Okay, now, can a pregnant woman take amoxicillin? If you got infection, you can take amoxicillin. Usually we try to avoid antibiotics in pregnancy. I suggest, if you don't need antibiotics, avoid them. But if you have any reason to take antibiotics, take the ones that are safe for pregnancy and that you're not allergic to. Amadi Ijoma, can you join the services in UK? You can, but I can't see you physically in UK. But I can go through your results and give you a second opinion on your results in UK. I'm not in Nigeria. I'm in UK, but in UK system, I can't see you physically because of the different health system in UK. It's a GP referral based system, but I can go through your results and give you the best opinion depending on your results after I've gone through them. Sir, what can one take for a particular time before obituary start? Maxine and Marachi, I don't understand your question, my sister. What can someone do for not seeing a period at all? If you're not seeing your period at all, that means that we have to do FSH hormone to know whether you're ovulating or not. First of all, if you're not seeing your period at all, we have to do your hormone profile to know that is this woman ovulating or not. To know that is she ovulating or not. And if you're not ovulating at all, then we have to know whether you've gone through menopause and then decide what is the next action to take. Okay, for you as a lady, you should be having period. If you're not having period for more than 6 months, okay, and you're both 40, 45 years old, the first thing first you should do as a doctor, I'll tell you, is to do your hormone profile. You don't have to see cervical mucus to know if you're ovulating. If you see cervical mucus or you don't see it, it doesn't mean whether you're ovulating or not. So cervical mucus is not a guarantee to know whether you're ovulating or not. That is for my lady on Instagram here. Okay, thank you, Amarachi. Before your husband travel, Amarachi, go and get your test done. Your hormone profile, get your husband's semen test done to know whether everything is okay. All right. Thank you, Inyechi. The ATG IVF Center opens June, July this year. Once we open, we'll let you know through the ATG Foundation. The ATG Women Foundation will be in charge of the AsktheGynaecologist IVF Center. The ATG Women Foundation is going to be open. It's going to be the support system for the IVF Center, ATG, so that people that want to support other women to get pregnant can donate, and they can assist other women, maybe through cash, through kind, through egg donation, to assist other women to get pregnant. We're going to open the foundation and let you know once we start that center, so that people that want to help with other people to get pregnant through cash donation to the foundation, or want to help other people in kind through egg donation, we can get everybody access to assist other ladies through the ATG IVF Foundation, which is already in charge and monitoring and managing the IVF Center henceforth. We also have people that are already counselors. If you want to join our team for counseling, you can also let us know. We have people waiting in line that want to be counselors. If you've gone through infertility journey before and you want to advise your other ladies, you can join the ATG team for counseling. We have ladies already there, already registered to be counselors for ATG IVF Center from London, from America, and few people too from Nigeria. So if you want to be a counselor, you want to donate, you want to help people, you want to see women's lives change, you can go to the ATG Foundation and be a counselor. If you've gone through a challenge before, you've gone through infertility, and you want to see other women smile, you want to put a smile on other people's faces, you can do that through ATG IVF Foundation and be a counselor too. You don't have to be a big person. You can do your small thing in a great way. AMH, somebody's asking a question, can AMH increase on its own? AMH is a test we do to know your egg reserve. AMH is a test we use to know your egg reserve. Once a woman is born, the amount of eggs you have all your life is deposited in you, and they will only decrease, they won't increase. So there's no way AMH will just increase on its own, because as you're getting older, your AMH level will be dropping because your egg reserve is dropping in quality and quantity. Okay, so that's the honest truth there. Ibukun Ogunleye, she's saying here, can someone with imbalanced hormone conceive naturally? Yes. There's nothing called never in life. It's possible. But most people with imbalanced hormones might have it a challenge to get pregnant. That is why, to know which hormone is imbalanced, we do all these hormonal profile tests. And if we see the hormone that is not balanced, we then tend to fix them by some medications if possible to ensure that they are balanced. And once they are balanced, chances of pregnancy becomes much, much better in your case. Someone is asking, after registering for premium services, will you join again to hospital? See, the ATG IVF Center is not the premium services, but for people that they've joined the premium services, definitely will give them discount and concession when going for the IVF. The IVF Center is different from the premium services now. It's common sense now. But what we do is that if you've taken that bold step to be a premium services member, definitely you give us your receipt that, oh doctor, I'm a premium services member. We will definitely give you discount. That is business. That is human feeling. If you're a premium services, I'll give you a discount now because you are part of me now. You're part of the team. We're working together. So if you're a premium services member, you get discount for coming to the IVF Center, but it's totally different. To boost progesterone, if your progesterone is low, we need to know, then we give medications to boost it, okay? Our ATG Center is in Lagos for now. We are not in Abia State or Abuja or Port Harcourt. We are only in Lagos. But if you need a referral to any of our colleagues in Abuja, Port Harcourt, Kaduna, Jos, we can give you a referral, okay? Thank you guys for listening to me today. Please, if you're late to the video, watch the video over again so you can learn one or two things. And if you're already here, subscribe to our YouTube channel to watch our videos sequentially and in chronological order. And also, don't forget one thing, subscribe to the YouTube channel and also invite your friends. Don't be a partaker of blessing alone. Invite your friends to ATG and God bless you. And thank you so much for being here today, watching me today. I love you all so much. If I've missed your name or mispronounced your name, apologies for that. If I've missed your questions, please apologies. I can't answer all the questions. That is why we have a premium services for answers that we miss or people that will miss their question. If you want one-to-one discussion with the doctor, with me, with Dr. Esther, join the premium services. And if you're already pregnant, you can join our antenatal service as well. And if you're trying to get pregnant, you can't pay for the subscription services. You can go to the GTC Telegram service. The GTC Telegram service. GTC means getting ready to conceive. For Beauty Gynae, she's asking for our offices in Lagos. Our offices in Lagos, the addresses we're going to put here again by our team members. Please, one of our team members, Lily or Esther, or Christina, can you help us? Can you help me answer Chinwe Okeke and put our address for the laboratory there? Please, please, please. So if you're already pregnant, join the antenatal service. If you're trying to get pregnant, don't want to join the premium services, you can join the GTC services on Telegram as well. I hope to see you tomorrow. And most importantly, I want to say this thing: ATG is love. And ATG, we don't want any negativity. To receive from God through us, we are just tools. You have to come with open mind and be open-minded and allow God to flow. Energy, positive energy flows through positivity, not negativity. Most importantly, I want to say I love you all. And when I say I love you all, I mean it genuinely from the bottom of my heart. I don't say this lightly. I don't say this just with my mouth. I say this with my heart. I love you all, and thank you so much for spending your time, your data, your presence here. And most importantly too, I love myself too. God bless you and see you soon. Have a wonderful rest of the week. Bye-bye.